I, I will speak about a couple of my amendments, but I'll speak about what's, I think is effectively amendments 305 through 320. And at some level, these aren't really about the dollars that are being spent in this budget. I think we are also thinking about the fact that the state is about to receive $3.8 billion into the Fiscal Recovery Fund. And that gives us a once-in-a-generation opportunity to genuinely solve some problems or, build for the future in a way that will take some imagination, some courage, some thought, but real commitment to focusing. I mean, I think that we all sit in this committee and know how easy it is, frankly, to spend several $1 million on really good ideas. But we have the chance to try to radically improve Tennesseans' lives in the next few years, and we should take it. What this proposal is, first amongst these amendments would be a $1.7 billion investment in health infrastructure. That includes rebuilding our water and wastewater infrastructure. That includes reinvesting in what the public health structure is. But it also includes something that I think gets lost in our conversations about Medicaid expansion. While I do think Medicaid expansion probably is necessary to help some of these rural hospitals, it's not enough, frankly, and you're going to have to do more. So what this proposes is setting up a fund of about $600 million that would be matched dollar for dollar at the local level or by the private sector, so that and this really builds off what Chairman Watson's work on the rural hospital transformation, which has done its first round of studies. But we know if we look at those facilities that we have great healthcare needs in those underserved communities, whether they're in cities or small towns, and the facilities that are there don't match those needs. And so what this would do is create a revolving fund so that we can see the investments so that those communities can build the emergency room, recovery center, where you can deal with the emergent needs in a community without necessarily having the full service hospital that was lost in recent years. But really tries to make sure that I think all of us learned during the last year during the pandemic that hospitals are a vital part of our community, and we've got to do something to make sure that all of our residents can access what's critical about those services. But we have a chance to reimagine that right now. The second part of that is a sort of $625 million jump start to the economy. One of those that I actually really do want to encourage the subcommittee chair to look at is, I just lost the one that I'm looking at, but it's a $200 million investment in what's called the R7 job restoration model that focuses on how do you get people reskilled, how do you reshore jobs to the United States and to Tennessee, how do you, resecure operations on cybersecurity. What are the investments that we know we need to make right now to have the workforce and work going on that's going to help Tennessee succeed? And then another gigantic bucket that we've got in here is $1 billion that could be invested in childcare. So, if you look at the budget amendment, there's, I believe it's a $65 million increase for fast-track projects. Just imagine if we had a fast-track fund to create childcare centers in the state. I'm not sure if there's anything that could do more to help parents than if we just assisted or frankly businesses, that if we just invested in safe, affordable, good, decent health childcare. That's part of the infrastructure of our economy. And if you look at just all the data from the last year, women across the state and across the country have borne the brunt of the economic damage. There's one of the most devastating quotes that I saw about this said, there's in some countries there's a significant social safety net. Here we have women and mothers who are providing that child care, that health care, and homeschooling and everything else, one on top of the other. And making a significant investment in child care is something that could be, frankly, transformative to our communities, and isn't just something that, that families want. When I talk to business owners who are trying to set up shop or trying to stay competitive in Nashville, this is the #1 public policy issue they bring up with me. Like, if you talk to the managing partner of a law firm in Nashville, or talk to the investment banker, or talk to some of the people who are the Amazon folks who are coming in, finding the child care investment that we need it may be as important of a business investment as it is anything else. I mention all these, and I appreciate the members' times, but the people on this committee really are important to this budget making process, and we just will have an opportunity in the next 18 months to make decisions that are made once every 30 or 40 years in the government, right? Like the decisions that got made in the New Deal, like we are still living with those decisions. The decisions that got made when we, did the Interstate Highway Fund in the 50s. Our lives are structured around those decisions. We have a chance in the next few months to make some big deal investment decisions that could be transformative to the state. And, I think I and the members for whom I presented some of these amendments, I think just want to start some of that conversation and help us sort of, and I know that I don't think that there's a monopoly on good ideas. I think that every single member of this body could come up with ideas that could be transformative, but I think we have to set our sights high, have some ambition, and really reach for the fences to try to make a significant difference in the life and in the future of Tennessee. And we've got to do that in the next 18 months. So thank you, Mr. Chairman.